Hey, my name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Chandler, Arizona. Thank you so much for tuning into my podcast. Welcome. Today, I wanted to talk about blood pressure. It is a great topic to discuss because so many people have issues with it. And there's so much confusion around it. I want to specifically talk about a case that troubled me greatly. Let me get specific and go right into it. I have a patient who started seeing me a year ago and just a great guy, wonderful father, husband, just one of those people you want to go out on a limb for and just work hard for because you can see the case. And well, you feel that way about all your patients. As a doctor, you should always find something in the person in front of you that's amazing. That's part of your job. We're human beings. We all are. And there are times when you're going to go to work, say you're in the service industry, and say you're waiting tables or whatever you're doing, and you're just not into it that day, and you don't want to be there. You still got to figure out a way to get through it. You can do it by being fake and putting on the fake little thing, pretend, but people sense that. They know that. When you're operating at this level as a physician, it is so important to learn the skills of setting yourself aside and being there for that person in that moment. You set yourself aside every dang time. They need it. They deserve it. And why I'm saying that you should find the best thing in the person in front of you, see the beauty in the person in front of you, is because that's who you're treating. They have dignity and a life. And they are worth everything. It becomes so easy to give your best when you see the beauty in the person in front of you. So that's my advice to physicians who may or may not be watching this. So that's easy for me to do. I love doing it. I think that's one of the reasons why I love my job so much. If you spend the time to really look at the person in front of you and see the beauty in them, you can't help but love this kind of work then because you're working with that. You're trying to help these beautiful people. In the case of this one guy, he is exceptional, he's just one of those people I look forward to seeing him. He's a good guy. And so not much care necessary. Okay. Started seeing him, he's in his mid-30s. We just worked with diet a little bit, worked with his hormones a little bit, not a lot. And he went from, I think, 30% body fat to like 20% body fat. And for men, it should be 10 to 20% body fat, somewhere in there. And this is not aesthetic when I say that. I want it there because that's healthiest. Okay, this is more about health for me. It's not like you'll look better here. So I really am more about you being well. So his came down and I'm super happy with that. And his healthy muscle mass improved and his inflammation levels are low. His cholesterol is great. Everything is beautiful with this guy. And I feel like to myself, this is my best work in these cases when I don't have to do a lot. When it's him doing a lot of that work at home, he just needs the guidance. He just needs the labs. He just needs someone stand next to him and be like, this is what this means. This is what this is. And to run those labs and be present with him so that he can make these decisions to have the amazing life he's supposed to have and be the dad and the husband and the person he's meant to be. That's my job. All year that he's been coming to me, he's had really high blood pressure. I never have had a single reading with him normal. This is the part that's tricky as a physician. When someone comes and presents to your clinic and they're seeing you for one thing, they say, this is what I want to see you for. And I see hypertension. I'm like, well, how is this? And if they're under care from another doctor, it's not polite for me to just step in and say, forget them. I'm taking over here. That's arrogance. And it does not pay to be an arrogant doctor. And that other physician may be doing a workup to figure out this guy's blood pressure. And me getting in the middle of it is really going to not be helpful for the patient. It's so important that doctors, we are aware of ego and never use it. It's not about me saying, I could do this faster, or I could do this better, I'm smarter. You never do that because that's not inspired work. So with this patient coming in and, I think he had four visits over the course of this year with me, it's never been normal. It's been high. We're talking like 170 over 100, high. 160 over 90 something, high. So at his last appointment, I sat down with him on Thursday and I was like, hey, I was so happy. His labs were just beautiful and he's just shining. The guy's a great guy. Again, I'm repeating myself. That blood pressure though, why is it high? What's going on? So he just talked to me a little bit about it. And he said, I'm on these 2 different medications from my primary, and he's on an angiotensin receptor blocker at the highest dose possible. Again, he's in his mid-30s, and he's on a beta blocker at the highest dose possible. That's, in medicine, not necessarily your best approach with someone that age. And not only that, it's just, if it's been like that for a year, and that's still the dose you're on and everything you're on, that's still not the best approach. That's really not a good approach. So in that case, I asked him, do you mind if I step in? I asked permission to step in then and be helpful. And let me tell you why this is upsetting. You go to your doctors with blood pressure elevation, your doctor should be getting it down quickly. Not quickly too fast, but your doctor should be fixing it on a schedule. We should see it here within a couple weeks. We should hear within a month. It should be stable by now. If you go to your doctor and they put you on a blood pressure medicine and let you ride and there's been no change in your labs, no change in your blood pressure, and they just increase the dose and there's still no change, they're supposed to change it till it does work. So in my office, blood pressure is elevated. We do lifestyle, always lifestyle. I try and figure out why it's high. Is there sodium high? Is there potassium low? There's different things I can look for in lab work that can point me in a direction. Stress levels, things like that. How can I be helpful for them? Sometimes I need to walk in and just prescribe something as simple as a mineral like magnesium. Love magnesium, lowers blood pressure like a charm, does a good job. But if you don't have magnesium deficiency, that's not the problem. So with these cases, my job as the physician is to figure them out. So I would prescribe a protocol. I would have their blood pressure checked within 7 days at least. Sometimes less, sometimes a little bit more, depending on how high their blood pressure is. But I'm being accountable to them. I'm being accountable to the protocol I prescribed. I'm making sure it's working. If it's not working within a week, I'm changing it. If I think it should be fixed within a week, I'm going to change the protocol until I get it to work. This man, this patient, was left here for a year with his blood pressure being the same every single time. His last appointment with his primary care, the primary care told him, you just lower your sodium intake. And that's where I think I lost it the most. Because that doctor was obviously not looking at the kid's sodium. I shouldn't say kid. Everyone below 40 is a kid to me. I'm old. I've gotten old. So sorry. But as a kid, the guy, his sodium was beautiful. His sodium was 137. Above 140, I get it. You want to lower it a little further down maybe. But at the level he was at, why? That's not causing his hypertension, the sodium. So the doctor wasn't even running the labs for his electrolytes. The doctor just gave him off-the-cuff advice to lower his sodium. Why is this important? A man in his 30s with hypertension, Brendan, how bad is it? Risks for people with having hypertension through their midlife, developing Alzheimer's later in life, are pretty freaking high. It just is. Your blood vessels are not meant to withstand chronic pressure elevations, like having a blood pressure of 170 over 90, 170 over 100. You can withstand it for a while, but long-term, no. This man deserves the best out of me. It is so easy to keep adjusting the protocol. There are established protocols on how to manage blood pressure, on how to introduce different medications, how to create a better balanced protocol. And he deserves that. I know a lot of you who are my audience out there are huge proponents of natural lifestyle, diet, electrolytes, exercise. I want you to know I've done that with him. And that's the part that frustrates me, is because the guy is healthy as can be. It really is a beautiful transformation in his health. His electrolytes, perfect. Nothing wrong with him. His potassium was like 4.4. His sodium was, I think it was 137, as I mentioned. What am I going to touch there? You know, how am I going to drop his sodium there? Why do I increase potassium any more than that? More magnesium? I mean, potassium, magnesium are synergistic there, but is that really what it's going to be in this guy? No, not at 170 over 100. That's not a magnesium issue, especially when his potassium's that way. So what else is it? Until proven otherwise, it's genetic, and I got to figure this out now. But even so, I got to stabilize him. I want him 120/80. If there is a lifestyle thing that I didn't see, if there is an electrolyte issue, if there's a supplement that I could use, I'm all in. But he shouldn't suffer while I'm trying to figure that part out. My take home on this is this. If your doctor parks you on a medication long term and you're not having results, that is not your doctor. We've talked about this in previous episodes. People are parked on antidepressants for decades. That's not your doctor. That's not a doctor. That someone's writing you prescriptions? Sure. That doctor is not a doctor. I don't know what they are. If you have hypertension and your person's writing you prescriptions and there's no changes in your blood pressure, that person's not your doctor. I don't know what that person is. Because your doctor works for you and does a good job at trying to figure it out. They won't always be perfect. Your doctor won't always figure out your blood pressure on the first try. Sometimes they will. Awesome. Sometimes it'll take a little while. But how you know they're a good doctor? They don't stop until your blood pressure's right, because you are meant to live a beautiful life. You are an amazing person. There is so much you bring to this world. The world is lucky to have you. Your doctor needs to see you that way and treat your life as being precious. I hope that helps. Please like, share, and subscribe. Comment below if you have issues with your blood pressure. I mean, if you've gone to your doctor, how many of you have been put on a blood pressure medication and it did nothing for you? Or how many of you have tried supplements and that was all you needed was your potassium being regulated or your magnesium? There's all these wonderful ways out there. So if you've had one of them, please comment below, because when you make a comment, other people read it. You know what I mean? And I'll leave it up there. We leave your comments up there. Now, every once in a while, someone's gonna be crazy and write something insane in there. Justin pulls those, I'm sorry. So if you're going to write in there something about us selling your supplement for you on your website, the link to that, sorry, we got to pull that. But I mean, if you've seen magnesium work, if you've seen something that you really believe in, put it on there. You don't know who's going to read it. You don't know who you're going to impact by doing that. Please take advantage of that. I appreciate it. Thanks again. I'll see you at the next episode.